Hello and welcome to IMED, Introduction to Health Information Resources for Medicine. My name is Andrew McClellan. I'm the Head of Collections and Technical Services at the Health Sciences Library at McMaster University. This video will provide an overview of the services and resources available through the Health Sciences Library. We will begin by navigating to the Undergraduate Medicine LibGuide. From the Health Sciences Library homepage, on the Guides and Tutorials tab, select Explore. Scroll down to Medicine Undergraduate. This guide is organized according to the curriculum. There are sections in support of pre-clerkship foundations, anatomy and physiology, clinical skills, clerkship, Indigenous and Black health resources, evidence-based medicine, and research support. The landing page is called Core Resources. This page contains a section on quick lookup resources. The Merck manual is handy when you need to check a lab value, or if you just want an authoritative introduction to a topic. Below Quick Lookup, you will see Nature Review's disease primers. Each primer provides a global overview of the field and outlines key open research questions. Below this, you will see examples of popular textbooks and ebook packages containing key medical titles. The most popular packages are Access Medicine and Clinical Key. Access Medicine contains approximately 80 books, along with cases, videos, and other multimedia. In it, you will find Harrison's, Goodman and Gilman's Pharmacological Basis of Therapeutics, the Lang series on current medical diagnosis and treatment, Hearst the Heart, and many others. Clinical Key contains over 1,000 health-related books, as well as articles, guidelines, and patient care materials. When searching, you may wish to limit your results to books to reduce the number of results. It is worth mentioning that the library contains a wide number of books beyond what is listed in the guide. You may search these titles using the catalog search box on the library homepage. Your search term will pick up book title or chapter title, but it should be noted that it does not search across full text. Only searching from within the book platform enables you to search across the full text of a book. You may search for journal articles using the default catalog search, or you may wish to use the journal search, which searches only journal titles and will provide more specific results. A third way to locate journal articles is to search databases. The library has created several tutorials on database searching, and these are available from the Guides and Tutorials section of the website. When searching databases, such as McMaster's instance of PubMed, you will see links to our subscriptions within the search results. The Get It link provides full text. Going back now to the Medicine Guide, below Core Resources is a page designed to support students from a non-science background. These resources and chapters were selected by faculty in MD Affairs. The next section of the guide focuses on medical foundations. The resources on these pages were recommended by students in previous years. If you wish to recommend a resource, you're welcome to contact Andrea. Our anatomy and physiology resources support and enhance the educational materials generated in-house by our anatomy department. Team Med1 Education contains many anatomy and physiology atlases, including the popular Gilroy. A new resource recently selected by students is the Visible Body 3D Suite. These are also available as an app. Moving to the Clinical Skills page, I would like to draw your attention to Bates' Visual Guide to the Physical Examination and the Rational Clinical Examination, which may be found in JAMA Evidence. On the Clinical Skills page, you will also find resources in support of medicine for vulnerable populations. From the Drugs and Natural Products page, you will find CPS Full Access, which contains the Canadian Compendium of Pharmaceuticals and Specialties, plus Micromedics and Natural Medicines. All three resources are evidence-based. The clerkship page shifts our focus notably toward patient care. At the top, you'll find evidence-based point-of-care tools like BMJ Best Practice and DynaMed. Underneath this section, you will find a link to our mobile apps guide. All resources with mobile apps are available in this guide. We will take a closer look at DynaMed. This DynaMed example illustrates the type of content you can expect to find in an evidence-based patient care tool. When using any tool for patient care, pay particular attention to the authority of the author and the last updated date. When you examine the recommendations in this entry, you see inline references to the cited resource. Another hallmark feature of evidence-based resources is the assigned grade of evidence, for example, Level A. Evidence-based resources will provide an explanation of their grading systems. You can learn more about evidence-based medicine and quality grading through JAMA Evidence. One last point I would like to mention before moving on relates to framing your patient care question. PICO is a framework used to develop quantitative questions for research projects or for searching topics in point-of-care resources. The example before you is how a question may be broken down into searchable components. Moving on to diagnosis, on the clerkship guide, we will find a section dealing with diagnostic tests. This information is also embedded in BMJ Best Practice and DynaMed. I would like to draw your attention to our differential diagnosis tool, Isabel. A link to Isabel is also available from within DynaMed. At the bottom of the clerkship page, you will find a list of specialized resources. TEMA neurosurgery and plastic surgery are premier resources in those specialties and are designed for residency, but they will be of interest to some students. During clerkship and leading into your LMCC exams, you may be interested in the LMCC prep page, the cases page, the landmark papers. All of these pages seem immensely popular and are heavily used. Turning our attention to your research interests and needs, please be aware that the librarians at the Health Sciences Library provide research consult support for your database searching. A link to the consult booking form may be found from the research support page of this guide or from the library homepage. For those interested in publishing, the library maintains a fellowship status for BMJ case reports, which grants our faculty and students a waiver on author fees. To request the code, please contact Health Sciences Library Collection Team or Andrea. A final note related to resources is the proxy URL. The proxy URL page provides instruction on how to add the McMaster proxy to any link that you may have. This will enable you to log into subscribed resources using any link. Near the bottom of the guide, you will find a link to the Student Wellness Guide, which was created by McMaster medical students. If you wish to add resources or edit this section, I am happy to make those changes on your behalf. Please contact Andrea. Should you require general help, please reach out to the Information Services Desk. It is open Monday to Friday during business hours. If you encounter access issues with our resources, feel free to contact Andrea directly to expedite a resolution. Good luck with your studies, and please do not hesitate to reach out if you need support.